Assalamu alaikum warahmatullah. I hope all of you are doing well. So today our lecture will be on epidemiological study designs, and I want to let all of you know that there will be two parts of this lecture. The first one is where I will be talking on the overview of study designs. I will speak briefly on the different types the classification of study research and study designs, and we'll touch very briefly on the observational types, which are cross-sectional and prospective cohort, and also case control design. In the second part, we will go deeper into the different types, and we will also talk a bit more on the experimental design, which is randomized control trial and quasi-experimental study. So allow me to share my screen first. And I hope you can see the slide now. Let me try again. Okay, so this is the introduction. I've prepared the learning outcomes for all of you. What we're trying to achieve today is that first we will understand what is research and study design, and then we'll try to identify the classification, the types of study design, and the basic criteria of each type. And then we'll try to learn the basic differences between observational and experimental study design. Okay, and finally, we'll try to understand the basic features of therapeutic versus prognostic versus diagnostic versus etiologic research. So I'm not planning to spend too much time on number 4, but I think number 1, 2, and 3, these learning outcomes are more important. So we'll be focusing more on this. So first of all, I want all of you to understand why it is important for us to study epidemiological study design. You need to first understand what is study design. Okay, so basically it is a framework or a sequence of methods, all right, or a group of methods and techniques that a researcher chooses, okay, to combine various components, right, in a study that you conduct in a reasonably logical manner to address a research problem. So basically, study design gives you an insight about how to conduct research using a specific methodology. Now, if you look at this classification now, right, you might feel like there's a lot, right? There's a lot of things to know, but I'll try to simplify it for you, okay? So if you look at this diagram, you will see that research is basically divided into two types. We have primary and secondary, okay? Primary basically means that you have your own data, you collect your own data, and sometimes people also call it original study, right? And secondary usually means you rely on existing sources. That means whatever data that maybe someone else has collected, or data and findings that have been already published in scientific journals. Okay, so you make use of whatever is existing in order to generate and synthesize your own new findings. Okay, but for today, we're going to focus on the first type, which is primary, and we will focus only on epidemiological study and clinical trial, the second and the third one. Let me show you a different way of classifying study designs, and I think this is simpler and easier to understand. You can also classify it according to either it is descriptive or analytic. Okay, so when I say descriptive, it is basically just to describe your data or describe your findings, right? And most of the time when people say descriptive study, they are referring to either a survey, right, a cross-sectional study, or a qualitative study. When you say analytic, then usually it can be either observational or experimental, right? Under observational, it can still be cross-sectional. Okay, some types of cross-sectional study can be analytic. It can be cohort, it can be case control. And under experimental, you have randomized control trial, you have quasi-experimental, and you actually still have more types of studies under experimental, but we're just going to focus on these two for now. So the meaning of analytic is that it goes beyond describing. So basically, you're not just describing your results or your data, but you're also trying to come up with some sort of associations or cause and effect, that sort of linkages or relationship. Basically, you're trying to find out maybe the risk factors for something, or if a certain I would say risk factors or cause would actually impact your outcome variable in a certain way. So in other words, you're trying to establish association or causation to some extent. And that is when you call a study analytic. So to make you understand better how study designs are classified, okay, there are actually many ways how we can categorize study design. So as I have just presented to you the slide before, if you remember, sometimes we can classify studies according to the purpose, right? So if it's descriptive versus analytical, for example, so basically the way we are classifying it is because we look at the purpose of the study. Is the objective of the study to describe the data, or is it to analyze in such a way that you're trying to establish some sort of association, right? Okay, number two, if you see number two, sometimes the studies are classified according to the nature of the data, right? For example, when you say quantitative versus qualitative, so you are actually telling people that this is the nature of my data. My data, is it quantitative or is it qualitative, right? So that's how you classify it. And sometimes you can also classify it according to the direction of time frame. Is it prospective? Is it retrospective? So when you say prospective, that means you are looking to the future, right? That means you are following up and you're going to the future. You're looking at something that has not happened yet. You wait until it happens and then you document what happens. Retrospective is the opposite, right? So you look back into the past and see what has already happened, and you collect data by asking someone what has happened before, or you look into the medical records, for instance, to check what has happened maybe in the last 3 or 5 years. Okay, no, so now a very brief I would say comparison between experimental and observational study. You can see that when someone says, well, let's look at the right column first, observational study. So when someone says observational study, usually we mean something or a study or an investigation where the researcher is just there as an observer. What your role is just to sit back, observe, and document, right? You do not do anything active to intervene in your research subjects, or you don't in any way try to manipulate any variable, okay? And examples of observational study, of course, you have cross-sectional, cohort, case control. These three are the most popular ones, but of course, we have other types. For example, ecological study, we have a case report, case series, and all that. These are all observational and also descriptive in nature, okay? And then on the other hand, in contrary, when you talk about experimental study, from the word experiment itself, that means you're experimenting, right? You're trying to intervene in some way, or you're trying to manipulate, right, your independent variable to see if it affects the dependent variable. Okay, so examples of experimental study can be RCT, quasi-experimental, and some other types of design, but we're not going into those today. Other differences, okay, as you can see here, observational studies usually imply correlations and associations. That means even if you can establish some sort of relationships, these are just correlations or associations. It is not cause and effect. You cannot basically say that any observational study can establish causality. Okay, but that is the opposite when it comes to experimental study, because experimental study will give you a more robust finding, I would say, when it comes to determining causation, or the in other words, the relationship between independent and dependent variable. Experimental studies are usually more difficult to conduct and more expensive and more resource intensive as compared to observational studies. And of course, in experimental study, we have more ethical concerns compared to observational study, because we manipulate the variables, right? And most of the experimental studies that you will see have actually to do with introducing a new drug or a new type of treatment to see whether it is effective or not. So in a way, it is more, there's a lot more ethical challenges or ethical issues that you have to think of when you want to conduct an experimental study as compared to something observational. Because in an observational study, you most of the time, you just sit there and document what is happening, or you look back at what has already happened. So there's not much of an ethical issue to be worried about. Now, the first type of observational study that is, the most frequently used, the easiest, and the most popular one is cross-sectional. So the word cross-sectional basically means something like, another name for it is a snapshot study. What it means is that you basically collect data just at one point, right? At one point, you engage with your study subjects, you collect all the data, and both the exposure and outcome variables are collected at the same time. And then so you have your study population, right? And then you go down to the field, maybe collect data, or you administer a survey. Okay. From there, you will actually know who are those exposed and who are not exposed, and those who are cases and controls, right? So you don't choose them, you don't determine who the cases and controls beforehand. You start with sampling and getting your study subjects, and then you collect data in one go, and then you analyze the data. So you don't do any follow-up, and you are not doing any sort of intervention. You're just basically observing and collecting data, and then you analyze it. We'll talk a bit more about cross-sectional study and its pros and cons later. Okay, so the second type is case control study. This is also a very famous type of observational study, but the difference between case control and cohort is that, sorry, not cohort, cross-sectional. In case control study, you start with the case. Okay, what is a case? A case means study subjects or individuals with a particular disease that you are interested in. Like, for example, if your interest is to study cancer patients or patients with diabetes, so you start by identifying patients who are already diagnosed with that disease. So you look for these patients, okay, maybe in the hospital, maybe clinic, maybe in the community. And once you get them, and then you find another group of people that you call the control group, okay? So then you sort of look back to the past, okay? And that is why case control is considered a retrospective study. You look back into the history, into the past, either by asking them questions or by looking at their medical records. And then you look at, so why are we doing this? We look at the past because we want to look at their risk factors, and we want to determine if there is an association between the disease that they have and whatever risk factor that we ask them. And then once you get the data, you will compare between the first group, which is the case, and the second group, which is the control group. Okay. Again, we'll be talking more about case control later, but I'm just giving you an introduction. So that's the main difference, right? If you remember the first type, which is cross-sectional, okay? We don't start by selecting cases or control. You don't have to do that. You just start by doing maybe some sort of random selection of individuals from the community based on who your study population is, okay? And then once you get your study subjects, you administer the survey, then only you will know at the same time who is the case, who is the control, who is exposed, and who is not exposed. On the contrary, case control study, you start by selecting the case, and then you select the control group. You look at the past, look at their history, and then you collect the data and you compare between the two groups. Now, the third type of observational study is called cohort study. Another name of cohort study is the prospective cohort study. So actually, there are two types of cohort study. You have a prospective type, we have the retrospective type. If you talk about, if people just say cohort study, most of the time they are referring to the prospective cohort study, which means basically you are looking to the future. The big difference between cohort study and the first two types that I mentioned just now is that cross-sectional, in cross-sectional and case control, we usually ask the study subjects about their history of exposure or history of risk factors. So in a way, these two are retrospective because we are asking about the past. Cohort study is the opposite, where we will wait and follow up the patient, and we will collect data as time moves along, okay? So for example, if you look at this diagram, right, you will sample a group of people, okay? And then, of course, the first criteria when you sample a group of people is that you need to make sure that these people are free from the outcome that you're interested in. For example, okay, if you want to test or if you want to know whether smoking leads to lung cancer, right? Okay, this is a very traditional or conventional, hypothesis. We all know the answer already, but I'm just giving an example to help you understand. So if you do this kind of study, you will first have to sample a group of people who do not have lung cancer, right? That's the first criteria. You have to make sure that these people do not have the outcome. Because if they already have that outcome, then there's no point of studying them. Because you want to know whether their risk factor, which is smoking, leads to that outcome. So you need to make sure that in the group of people that you sample, some of them are exposed, some are not exposed, right? That means some will be smoking, some will not be smoking. But you have to make sure that they're free of the disease to begin with. And basically what you do is that you will follow up. That means you will collect data the second time, third time, fourth time, doesn't matter how many times, but you will wait, maybe after 1 year, you come back to the same people and collect data. You wait for the second year, third year, and eventually you have a big set of longitudinal data where you look at it and then you will do the analysis. We'll talk about the analysis in the second part of the lecture and not today. Okay, so study designs, okay, may depend on the research question, okay? What I mean by that is if you look at this table, for example, you can also determine the study design depending on the objective or the research question being asked. For example, look at the first one. If your question is that, is this treatment effective? Okay, imagine there is a new therapy, there is a new drug, for instance, and you want to test, you want to know whether it is effective or not. So based on that question, right, you can understand, or you can kind of sort of predict that the most suitable design for this question would be a trial, a clinical trial. It can be a systematic review, maybe the first one that I put there, depending on what you want, right? Because when you do literature review, if you find that many people have already done clinical trials on that drug, then rather than replicating a clinical trial, then you can just do a systematic review. But if it is a very new drug and nobody has studied it before, or maybe you just have 1 or 2 studies with very small sample size, you can actually conduct a randomized control trial to test whether the therapy is effective or not. So the same for others. If you look at number 2, 3, for instance, or even number 4, right? What causes disease? Or maybe if it's a prognosis kind of study, for example, what factors predict the outcome? Okay, so you can do a prospective cohort, right? You can sit down with a group of patients and then collect data and do follow-up, or you can also do case control in a retrospective way. But as I said, prospective cohort, since it is, I would say, it takes time into consideration, prospective cohort study is always considered a more robust or a stronger type of study design compared to case control and cross-sectional. Okay, so this is the first thing that I want you to understand, that your study design will very much depend on your research question or on your the goal of your study. Now, we will shift from study design to research design. Okay, so these two terminologies are not so different. They overlap with each other. However, some people, or I would say some experts, do make differentiation between them. I don't actually think it's a big deal or it's a big problem, but we'll just go through the slides to kind of give you a better idea what some people might mean when they say research design instead of study design. So in general, okay, this is not everything, but I'm just giving you the basics of research design. In general, when people say research design, this can be classified into 4 types. It can be therapeutic, etiologic, diagnostic, and prognostic, okay? So what does each of them mean? Therapeutic research, okay, is basically a study that aims to test the effectiveness of a new treatment, okay? I think this is quite straightforward. You understand this. If there is a new therapy, new drug, new surgical procedure, and you as a researcher, you want to do a study to see whether this new treatment, this drug or surgical procedure, is it really effective? Does it really work to cure a certain disease? Then when you conduct this kind of research, it is called a therapeutic research, okay? The design, can be RCT, it can be a quasi-experimental, it can be even a cohort, right? Prospective cohort, for instance. So you can see here, sorry about that. You can see here that this is an example of a therapeutic research, okay? I'll just give you a minute there to have a look at the topic. Okay. So basically it is testing, right? A new kind of treatment to see whether it works or not for COVID patients, okay? Now, the second type, etiologic research, is a study that aims to investigate the causal relationships between risk factors and a given outcome, okay? So this is more like the analytical type where you're trying to establish associations. So what you're doing is that you want to see whether there is association, there is a relationship between certain risk factors and the outcome, okay? And common study designs, we have talked about this earlier. It can be cross-sectional, it can be case control, it can be cohort study. Okay, this is an example of etiologic research. You can see that the topic is risk factors for bulimia nervosa, a community-based case control study, okay? Etiologic basically means from the word etiology, which means causes. So you're trying to find causes of a certain event or disease or risk factors of a certain disease. So diagnostic research is the third type, and this type of study evaluates if a particular test discriminates between the presence and absence of a disease, okay, as determined by a reference standard. So this is, in diagnostic research, you will come across some more, newer terminologies like sensitivity, specificity, likelihood ratio, and predictive value. All this is basically because a diagnostic research, when you do conduct this kind of study, what you're trying to do is to actually know whether a new tool or a type of test that you are interested in is effective or not in identifying those with disease and identifying those without the disease, right? That's why you will have to later know like the sensitivity and specificity of certain tests. So again, if you look at, okay, no, I don't want to go into this because I don't think this is actually a very good example. This is to show, okay, if you look at this 2x2 table, basically this is how you can calculate sensitivity and specificity when you conduct a diagnostic research. Okay, I'm not going to go into the details, but I want to let all of you know that when you do a diagnostic study, these are among the measures, right, or the metrics that you will encounter and you'll have to understand. So when we talk about 2x2 table, as usual, you have the first column, those with disease, the second column, those without the disease, and then, but the column on the extreme left, right? You can see positive and negative. Positive means those who have the risk factors or who are exposed to a certain risk factor. And the second row is negative, which means those who are not exposed to a certain risk factor. Okay, so in this case, right, if you're using a test or a tool to discriminate between people with disease and people without the disease, you will see that, for example, if okay, let me show you this next. Yeah, okay, I think this is a better slide because it gives you, it's easier to understand. You can see here that, okay, for example, if someone let's look at the first box on the left side, the upper left side, okay, true positive, TP, right? Okay, what does that mean? So that basically means that someone with the disorder, right, the person actually has that disease, and when you use that test, that tool, you actually get a positive test result. So that is a true positive. Okay, it means basically that you use the test tells you that, hey, the result is positive, and it is in fact correct because that person has that disease. The second box, the box to its right, if you look at the diagram, it says false positive, right? So that basically means that you test someone, okay, the result comes back as positive, but the person actually does not have the disorder. The person is not sick, but tool, the test is telling you that she is sick. So that is a false positive case. Now we look at the second row, the first box on the left side, it says false negative. So false negative is the opposite, okay, where you actually test someone, okay, the results come back and say that it is negative, right? The person is free of the disease, but actually the person has that disease. The person is sick, so it becomes a false negative. And the last one is true negative. That means you test someone, the result says negative, and it is correct because the person is without the disease. And if you look down here, these are the formula. How do you calculate sensitivity, specificity, and PPV, NPV? Basically, if you look up here, is the positive predictive value and negative predictive value. I'll give you like maybe 30 seconds for you to look at this, or if you want to write that down. Okay, so without dwelling too much into this, as I have just explained to you, sensitivity basically means proportion of people with the disease who have a positive test result. I apologize for this. It's actually kind of blocking your view, I think. I'm not sure how to move this. Okay. So I'll read it out to you, okay? Sensitivity is the proportion of people with disease, okay, who actually come back with a positive test result, okay? Specificity, on the other hand, is the proportion of people without the disease who have a negative test result, okay? That means if you are able to detect people without the disease with a negative test result, Okay, that means the test has a good specificity, right? On the other hand, if you can detect people with the disease, and at the same time they come back to you with a positive test result, okay, that means the tool is actually working. So that means the tool has a high sensitivity. PPV, okay, positive predictive value means the proportion of people with a positive test who have the disease, okay? And negative predictive value is the proportion of people with a negative test who do not have the disease. Okay, so this is some other metrics that you can calculate. You can also count positive likelihood ratio and negative likelihood ratio. There's some formula, but I think this is not something that we need to know at this stage. We can talk about it more later. And the last type, okay, last category in research design is the prognostic research. So from the word prognosis, okay, basically what you're doing in this study is that you're trying to predict the probability of a given outcome with the different combinations of predictors that you have in a specific population, okay? So in this study, usually your sample is individuals who are at risk of developing a certain disease, okay? And then the best design for prognostic research is usually prospective cohort study. Sometimes you can also do retrospective study, case control. You can even do a clinical trial, of course, a randomized control trial as a prognostic research. So this is, if you look at this article, okay, and I'm sure many of you are familiar with the Apgar score. You learn this in pediatrics. So this is an example of a prognostic study. What the researchers here are trying to do is to examine the prognostic value, okay, or of Apgar score at 5 minutes, okay, for the development and progression of ROP, retinopathy of prematurity. So basically, in other words, what they're trying to do is they want to see to what extent can the Apgar score predict, right? Predict whether a child or a baby will develop or will not develop ROP. So they look at the Apgar score at 5 minutes, and then they see like, and then they will basically follow up with the child and see whether later on the child will develop this condition or not. So this is an example of a prognostic study. Okay. So whatever you do in research, remember that the most important thing is to understand your research question. If you really understand your research question, which will determine your study objectives, you will know which study design to go for, okay? Because without understanding your research question, it is impossible for you to choose the best study design. I want to alert all of you that choosing the right study design is extremely important, because the study design is something that you have to plan way early. When you start thinking of doing a study, first you have your objective, and then you have your research questions, of course, your hypothesis, and then you definitely have to start thinking about the methodology, right? Which study design suits best what I'm trying to achieve. If you choose the wrong study design, it is usually irreversible. That means it is impossible for you to go back once you have collected the data and you have exhausted your resources. If you suddenly realize at that stage that this is not the right study design, it is impossible for you to go back and redo the study. If you do make a mistake in statistical analysis, for instance, that is still okay because you can redo the analysis, right? You still have the data. But a mistake in study design selection is something very, very dangerous because you cannot undo it. That's basically what I'm trying to say. So don't take it lightly, and be very cautious and spend a lot of time thinking thoroughly when you want to choose your study design. It also depends not just on your research questions and study goals, but it also depends on your resources, how much time you have, what is your budget, how much money you have, what is the manpower, how big your team is, because all that will have an impact on your ability to collect data, for instance, or to sample the right people, or to do follow-up even, and to complete the study for analysis and so on and so forth. So research is a lot of work, okay? But if you want to do it properly and in the best manner, you need to understand, you need to have a very robust understanding of the methodology, especially. So I hope this lecture has helped you in understanding the different types of study designs. We haven't talked about the pros and cons of each type and the biases that each study design can cause. We will cover that in the next part of the lecture, inshallah. So thank you so much. And if you have any questions, I know that this is a recorded section, a recorded talk, and we can't interact with each other live. But if you have any questions, you can always pass your questions to your public health lecturer, Dr. Aida, and she can pass the questions to me, or you can contact me directly through my email, and I will give my email in the second lecture to all of you. So thank you so much. Assalamu alaikum.